Actually, it's incredible. Casey and I were actually just discussing some of the other issues that you pointed out in your response back to us that pregnant incarcerated people face. And as you mentioned, shackling is something that receives a lot of attention, and I'm sure we'll get into that in our conversation. But I wanted to start off just by talking about some of the general care issues that are facing pregnant incarcerated people.
Right. So to start off, I can say that there's about 58,000 people who enter prisons and jails every year while they're pregnant. And some people don't know the difference between prisons and jails. It doesn't matter that much for this conversation, but we can say that a few thousand people of those 58,000 are entering prisons. Um, and most of what we know about the care issues that face pregnant women come from prisons because it's just so much easier to get prison data. Um, but prisons, as everyone knows, are not facilities that are designed to provide people, the best in care, mobility, diet, those kinds of things, right? These are facilities that are designed to punish people. And so when you bring someone into a prison or a jail who's pregnant, they face all these issues immediately. Issues like prison food. It's notoriously not nutritious, right? And many incarcerated people and advocates for incarcerated people talk about a lack of calorically sufficient diets. Now, pregnant people, you would think, would get at least some supplementary food for in their diet because of what they're going through. And many pregnant people report that they don't, and they're always hungry, right? There's also the issue of people who are pregnant and might have high risk pregnancies. For example, someone who has or has had an opiate addiction or an alcohol problem is going to have that usually translates to a higher risk pregnancy. Um, a few years ago, we looked at the various codified policies that prisons have around pregnancy, and we looked at whether there's a policy in a sample of, I think, about 21 state prisons around dealing with a high risk pregnancy, and most states didn't seem to have anything. So they won't they're not taking special steps to make sure that women with who are facing these particular risks are actually getting the care that they need. To put a little bit of a finer point on it, women who are coming into prison with an opiate addiction and have not been on opiate medication before to help them wean off of that, most prisons will not allow them to start. Some prisons will allow you to continue opiate medication treatment if you've been on it before, but it's uncommon to be able to start it. And I think that's really dangerous when it comes to people being able to actually have to carry through their pregnancy in a way that would be up to a medical standard that we would see on the outside.
Hearing all of this, I think kind of what stands out to me too is that when you consider some of the health issues that could be caused by some of these issues, and you think about like hypertension, you think about diabetes, these types of comorbidities, is that Black and brown women are more likely to have those, and then they're also more likely to be incarcerated. So it becomes a racial justice issue as well. How, especially with the prison policy initiative, how do you guys address kind of the fact that this is a racial justice issue as well as a reform issue?
Right. I mean, I think that just like you said, Black and brown women are more likely to be incarcerated than their white counterparts. Native women are actually even more likely to be incarcerated, and that's something that's just beginning to be studied. And as you said, there are all sorts of other chronic illnesses that are more common among Black and brown people, and they're more common among the prison population in general. Diabetes, heart issues, hypertension, and HIV, right? Now I'm not a doctor and I don't know, what the gold standard of treatment would be for caring for someone, who is pregnant who also has those problems. But I can tell you without a doubt that prisons are not providing that care. It's just not, it's Prisons do not provide good health care. They're typically contracting for healthcare provision with companies that are drowning in lawsuits, and I'm talking about literally thousands of lawsuits, right? And they're um typically providing basically what they're attempting to provide is healthcare that will not get them sued, right, or not get them successfully sued, um, as opposed to healthcare that's actually going to be sufficient for the health of the mother and the baby. Now, I mean, all of these issues, as far as I know, mirror what Black women and brown women are facing on the outside, right? Insufficient health care, issues that are endemic like comorbidities. I mean, I think when we talk about this from a prison standpoint, we're not talking about trying to, we're not thinking about some pie in the sky situation where states decide to just give people in prison better health care. It's about getting people who are pregnant out of prison and out of jail, right? Because there's simply no reason to incarcerate somebody who's pregnant and after they give birth to keep them apart from their child. I think it's a cruel thing to do, and we do it all too often without any consideration for the condition that the mother is in.
Yeah, and I wanted to touch on that as well. If you're able to, any sort of information on how these conditions are affecting then the baby once it's born, or
Mm,
I mean, we know, do the women after they give birth, do they get time with their child? Are
mm.
children being born healthy if they're being born in a prison or jail? Like, how do we know anything about that?
Yeah, we don't know a lot about the health of children that are born behind bars. We do know that it's not common in prison to be able to spend much time with your child. The prisons that do allow this are the ones that have some form of prison nursery program. So they've set up a particular program to, right, because prisons are not a place they're not set up to care for infants. So in order to allow any time with the baby, you have to have some sort of special program that's set aside. A handful of states do have these programs, but interestingly, something that a journalist named Victoria Law found a few years ago is that a lot of the slots in these programs are sitting empty, even though there are plenty of expectant mothers who are coming into prisons. And the reason is because there are all of these unnecessary restrictions on who can actually be admitted. For example, in Washington State, there's a prison nursery program, and I believe it excludes women who have violent charges, any kind of charge that is labeled by the criminal legal system as quote violent excludes you from participation in the nursery program. And what that is that impacts a lot of people, right? Even though a violent charge does not mean this person is going to be a risk to the health of their child, right? You might have a violent charge. Who knows what these charges are for? But it's ridiculous to hinge admission to a prison nursery program on them. And as a result of doing this, the very few programs that do exist to help women who are coming in and giving birth are not even really functioning. And I think that's what's the most stunning about all of this to me. Um, but yeah, I mean, I think um, it's something that I think more states should be doing, and I think that if states choose to do it, um, just take a take a more reasonable view of how can we accommodate every mother, right? How can we make it, because there's no point in creating a program like that and then just picking and choosing mothers that get to be part of it.
I do want to touch very briefly on the issue of shackling, because as you mentioned,
Mhm,
it is getting more attention, I feel like. But when we think about shackling, which to me feels very barbaric in a lot of ways, whether or not
mhm,
you're pregnant, it
mhm,
just seems a little bit hard to wrap my mind around. And of course, dredges up images of slavery and chain
mhm.
gangs and whatnot. But I'm curious if even with the renewed attention, or maybe not renewed, but first time attention that we're starting to see, is our general public aware that these issues, not just shackling, but even the food issue, the nursery programs, are we,
Mhm.
is our general public aware that these things are happening?
I think that people aren't really aware of this, and I think that that's not the public's fault. It's something that has to do with the fact that we have a massive prison system that's very focused on keeping the public shielded from what happens behind bars, right? And we have, to be frank, a news media that is very focused on demonizing people who go to prison or go to jail. Um, uh, and um, and so when we think about even mothers that go to prison or jail are often demonized in the media, and we think, well, that's where they should be, that's where they need to be, right? Um, for example, there have been successful prosecutions of women in multiple states over the last several years, who have drug addictions and are pregnant. So prosecutors are coming after these women who are just they're using drugs, and the prosecutors are saying, well, that's going to be a danger to your child. This is fetal endangerment, right? Um, and so people are being put behind bars for quote unquote, endangering their child, even though the science does not back this up, right? The science does not suggest that, you're more likely to have a stillbirth, or you're likely to, you're likely to be killing your child, by using drugs while you're pregnant. People who are using drugs while they're pregnant do need care, but that's not really what these states are trying to provide, because, like we were talking about, the prisons are not providing opiate treatment, and so really what's happening is that there's this political mobilization, I think, that is demonizing women who are poor, are using drugs, are homeless, right? All of these different things that might make it easy to say, well, they're not like the other mothers, right? And that's, I think, what creates a political environment where, we kind of subconsciously turn away from all the things that, I think, if you think about it, that prisons are not a good place for people to be pregnant or people to be giving birth. Shackling, I think, has risen to more prominent attention because it is so clearly, so obviously, an image of harshness, right? Harsh punishment, like you're saying. It calls up images of slavery and chain gangs. And the unfortunate thing is that, I think, despite all of the attention that's been given to it, as of 2020, I think 23 states still had policies in place, that permitted or even recommended shackling. So it's this unfortunate thing where, you could have had shackling be an issue that brought to prominence all of the ways that pregnant women behind bars are mistreated, but instead it kind of became this focus thing where we're like, okay, we're gonna get rid of shackling in particular, and then, I think that issue gained some traction, in particular states, but just completely lost in others. And then, in most states now, we've made very little progress.
And I wanted to ask, besides the visceral sort of emotional gut reaction that we have to the idea of somebody being shackled while pregnant, just that
Mhm.
image of a mother and child, what are some of just what are some of the
Mm.
reasons why shackling is bad?
Yeah, yeah. I mean, I think it's uh let me see, let me kind of gather my thoughts here. Shackling it's abhorrent, right? Putting someone in chains while they are giving birth is antithetical to everything that we know about, what is helpful for someone who's going through an extremely difficult process, right? Um, it, Anyone who has ever given birth, can tell you how hard it is, right? How much it takes out of you. To also be shackled during that process it's incredibly demeaning, right? What I think is striking about this too is that it's really hard to if you had to come up with an image of something that was cruel and unusual punishment, right? I think shackling someone who is giving birth because you say that she could run away while she's in the process of giving birth, putting that person in pain and putting them in further restriction that's gonna inhibit physical mobility. That's cruel and unusual punishment. And yet, as I mentioned, this is still policy on the books in many states. It's still legal in most places. And so I think that's where you start to see the limits actually of the Eighth Amendment, right? And this idea that, we would never allow prisons to cruelly or excessively punish people. In fact, this pretty quintessential example of cruelty is still quite common.
And Wanda, and I wanted to ask quickly, and it's okay if this is something that the PPI is not addressing right now, but
Mhm.
I'm always concerned about recidivism rates. I think that recidivism is just something that probably doesn't get as much discussion as maybe it should. We kind of skirt around the issue a lot of times. But I'm curious, when we hear stories about women, for instance, who have had stillbirths, for instances, or miscarriages when they're incarcerated, and seeing the sort of attacks now on reproductive freedom and concerns
Mm.
over whether or not if you have an abortion and what qualifies as an abortion, you can be incarcerated. Is that something that is concerning at this time when we look at all of the health issues that are facing pregnant incarcerated people? Is there any worries that more women are going to be incarcerated or stay incarcerated because they were unable to have a healthy baby simply because of these conditions?
So if I can repeat the question back to you, what you're asking is, does the substandard healthcare in prisons contribute to recidivism, for women? Uh,
Yeah.
that's an interesting question. I mean, I think as opposed to recidivism, I like to think about success after release, right? So how many people who are leaving prison are actually going to be housed, right? Financially stable, getting health care after they're coming out of prison. And we have some statistics on this, and we know, for example, that about 25% of people who are on parole have no health insurance. And I think what this all says is that people who are coming out of prison are not getting the support that they need in order to stay out. So, if we can kind of move from talking about prisons to talking about jails for a moment, of that 58,000 pregnant people that I mentioned coming into prisons and jails every year, most of that is jails, right? So pregnant people who are being admitted to their county jail, and then they probably stay there for a couple weeks, um, and or even just a few days, and then they come back out again, right? Are those people, do those people get health care, right? Are those people's health care, is their health care improved because they go to jail, or is it hurt? I think in most cases it is hurt, because if you have medications that you're on, the jail will typically not make that much of an effort to keep you on those medications, right? They're not a pharmacy. Sometimes, and this is, I think, shocking, people who are on Medicaid before they're incarcerated, the jail will actually call Medicaid to have them disenrolled once they're booked, because technically you can't be covered medically by both the jail and Medicaid at the same time. It's a ridiculous rule from the 90s that I think we need to get rid of entirely. But people who were on insurance can come out of jail not insured anymore. And I think that what all that means is that jail is this incredibly destabilizing place that can often start a cycle of incarceration that ends in prison for everyone, and including women who are pregnant, right? And the more healthcare issues you have, the more vulnerable you are, the harsher those effects of jail are going to be.
And I want to go back to the beginning of our conversation, because you said something that I think is really important, which is about just no, we should not be incarcerating
Hmm.
pregnant people.
Right.
And I would love to delve a little bit into that, and what does that look like? Because obviously you're going to have individuals who say, but if you commit a crime,
Hmm.
you have to do the time, right? So
Hmm.
what would be an alternative if somebody is pregnant to incarceration?
Well, I mean, I think I want to emphasize that there are people in this country who describe themselves as pro-life, and when you ask them, they're never trying to provide specifics. So I'm I'm resistant to also, to having to, um, uh, for one thing, I think that this is an issue that actually does count as a pro-life issue, and I think that when we're talking about, women potentially losing their lives and babies potentially being harmed behind bars, we can start with the premise that incarceration of pregnant people um, is cruel and is not something that we should be doing in this country, right? Um, Alternatives. There are several states that have actually put this into practice. About 8 states, as far as we know, have implemented implemented laws that either restrict the amount of the distance that a pregnant person can be incarcerated away from their family, so that when they eventually do have the child, it's easier for them to visit, or they have implemented some kind of diversion program such that if you are pregnant, you're more like you qualify for a particular program that possibly requires you to go through drug treatment or mental health treatment. And if you fail the program, you go to prison. But if you succeed, you can stay out of prison, right? So these are pathways out of the legal system that some states have put into place. And I think that, if a handful of states can do it, all states can do it. What's important, I think, is to again make sure that women who are convicted of violent offenses, or who may have a history of, more criminal justice history than other women, are not automatically excluded from these programs, because this is something that can easily render a diversion program totally useless, even after you've done all this work to create it, right? And we've seen this before. Illinois, for example, has one of the most potentially robust diversion programs for women and babies that exists in the U.S., but it's been totally underused for the last several years just because of the way it was set up. Judges weren't informed that it was actually a thing, and I think that there were some restrictions on who could be in the program that kept people out of it. So there are models for this, right? But again, I think it's not something that we I think that noticing the amount of pregnant people who are going to prisons should, for a lot of people, be a wake-up call, and help people notice, all right, the legal system does not care, if if your health is going to be at risk, if your baby's health is going to be at risk by, putting you in prison. We're going to put you in prison anyway.
And I do want to be conscious of your time. So just one more quick question. We're seeing, as you mentioned, there are states that they're showing that there are possibilities, even if they aren't maybe utilizing those possibilities as much.
Mhm.
What do states need to do right now for women who or people who are pregnant and incarcerated? Is it simple as
Mm.
getting better food or better health care? What are some of the steps that the public can even be calling for from elected officials?
Yeah. Well, this is something that I think is uniquely difficult to do, because once someone is actually locked up, they are a quote unquote criminal. They're an inmate, and they no longer, receive this kind of public, that they're demonized publicly, right? But I think that there are examples of getting people who are who have a particular health risk released from prison, that we can see as recently as the COVID pandemic. So during COVID, for example, New Jersey instituted a special system of what's called good time credits. Good time credits exist in a lot of systems normally. You can rack them up for just good behavior inside. If you demonstrate good behavior, you earn time off your sentence. And what New Jersey did was basically said, for particular people, we're going to give you a bunch of good time and you can go home early, right? Or we're going to double the amount of good time that you would have earned normally, something like that. I forget. Um, but this is an example of a mechanism that states can use to expedite the release of certain people. So including people who might have young children or people who are pregnant. And that's something that the public can call for, right? In states that don't have a good time process, you can call for one to be established. There's also, I think, an argument to be made for compassionate release, or what's called medical parole, for people who are pregnant inside, who have recently given birth. The public could be calling for that. Um, Part of the reason that I'm suggesting this, as opposed to calling for better healthcare, is that there's so many efforts already to get people who are in prison better healthcare. You can look at Arizona as one example. There's been an ongoing litigation in Arizona over its prison healthcare system for the last 10 years. And what you see is the state switching from one terrible healthcare provider to another, to another, to another. And it's the sins of these companies are really, they only come to light a few years after they get the contract to provide healthcare. So it's getting people released to something where when they're released, right? They can go seek healthcare in a way that is, that they can go seek healthcare from trusted providers, right? And their families can help care for them. Trying to get people better healthcare while they are incarcerated is difficult because, again, prisons are these places of obscurity and not transparency, and it's hard to tell if anything's actually being done.
Wanda, thank you so much for your time today. This was such an important conversation. So we're so thankful. And like I said, when you responded to our email and you mentioned all of these other issues that are kind of going unnoticed because we kind of latched on to shackling, I think, in so many ways, because again, that just like visceral image, but just hearing about all of the other general care issues that are facing. And again, this isn't just pregnant incarcerated people. Obviously, this is something that
Right.
affects the entire incarcerated population. And so just thank you so much for your time today.